Aotearoa, good morning and thank you for having me here. I want to start by acknowledging first and foremost our common priority objective which we share is New Zealand to achieve our Smokefree 2025 target. But I also want to address the elephant in the room and, as has been alluded to, the emotion that will surround it. The government's repeal of the retail reduction, denicotisation and smoke-free generation amendments to the Smoke-Free Environments and Regulated Products Act. I appreciate the passionate support for the measures that were to be introduced and the dissatisfaction with the repeal. However, there's been so much noise in this space and so many numbers thrown around, but little discussion of the practical reality or caveats associated with the underpinning modelling. As a start, the measures were not going to be in place in time to make a marked contribution to smoking rates for the 2025 smoke-free target. We pinned achieving less than 5% daily smokers on measures that would have had limited time to make an impact by the end of 2025. We also lost perspective on the impact of each of the measures would have had and had dollar figures quoted that weren't based on the legislation that was in place, but instead on a scenario where all three measures took effect in 2023. Now I know no modelling can ever be perfect, and I appreciate that, but it's concerning when modelling results are reported as gospel without any acknowledgement of the gaps in the logic being applied. I would like to spend a couple of minutes discussing these practical gaps. First, at the time of suspending applications for retailers, there were fewer than 500 fully registered retailers, with no evidence that these retailers were evenly distributed around New Zealand to provide appropriate national coverage. The enforcement capability that would have been critical for underpinning this program was not in place and will not be in place until December this year, well after the reduced retailer regime would have commenced in July 2024. Denicotisation was modelled to have the greatest impact on smoking rates, but was not due to come into force until April 2025. That also relied on smokers being forced to access only low nicotine cigarettes with untested consequences at a population level. It would also have relied heavily on enforcement and did not consider the implications that the policy would have on the illicit tobacco market, or more broadly, transnational organised crime. Finally, the smoke-free generation ignored the statistics that smoking levels for under 17-year-olds was already at 1%, confirming that young smokers were not our at-risk group. I'm not expecting that we will agree about modelling and projections and the delivery of outcomes, but what we know is that our core demographic that need to change their behaviour are the long-term addicted smokers, and they need the right tools and support to quit. It's no secret we want people to stop smoking because we know of the harms. Smokers, their families, our communities and our health system all benefit from a reduction in smoking, and I want to see that happen. Navigating the way forward needs to understand who smokes and then take practical steps to help them quit to achieve our Smoke-Free 2025 target. But that starts with knowing where we're at. As you'll all know, the daily smoking rate was 16.4% when the New Zealand Health Survey began in 2011-12, and it dropped to 6.8% last year. However, there is a story within that. From 2012 to 2018, the smoking rate reduced steadily but slowly by a little less than 25% over 7 years. But from 2018 to last year, the smoking rate nearly halved from 13.3% to 6.8%. Something changed, and that thing was the widespread availability and use of vaping. There wasn't a proper plan for this, and there certainly should have been some regulations in place, especially to protect our young people. But the reality is, vaping has seen New Zealand make fantastic progress in getting people to stop smoking. In the last 3 years, 229,000 people have stopped smoking. More than a third, 79,000 of them, were Māori. Wahine Māori have been the most stubborn smokers, but they too have been quitting smoking, with vaping playing a key role. We have had phenomenal success with our young smokers. When the health survey started, there were 119,000 young smokers. Last year, there was 19,000. Our young people aren't smoking and don't want to smoke. The ASH Yes 10 survey shows 88% haven't even had a puff. For under 17s, we already have something like a smoke-free generation. That is a public health story we should celebrate. And I'd note that none of those shifts or achievements were built into the modelling around the last government's planned change to smoking laws. New Zealand is winning the battle against smoking, and that progress is a pretty good guide to what we need to do next and the problems we still need to address. Because of the shift in youth attitudes and behaviour, the long-term outlook for smoking, or should I say having New Zealanders not smoking, are good. However, we need to address the health issues facing existing smokers, and we have a commitment to Smokefree 2025. In June last year, there were around 284,000 smokers. To achieve the headline 5% smoke-free goal, around 80,000 people need to quit by the end of next year. If the average number over the last decade continued to quit, we'll get there. A 5% smoking rate across the country will be no small thing, and no other country has achieved it yet. Most importantly, smokers, their families, our communities and our health system will all benefit. But we aren't there yet, and achieving that national rate is not the end target. The broad outcomes of Smokefree 2025 are still our commitment. We want to stop the harm from smoking across all population groups. We have to stop young people from starting smoking and keep them smoke-free. Having the adults around them quit helps. And we need to increase the number of people who successfully quit smoking. And we need to increase the number of people who successfully quit smoking. But to talk this through briefly, we are down to what we can describe as the hardcore smokers. I've seen data that around 80% of those quitting over the last decade were under 45. By age group, the highest rates of daily smoking are among those aged 45 to 64. They are addicted, and they have been smoking for a long time. Also, of course, Māori in particular and Pacifica people have much higher smoking rates, and within those groups, younger cohorts are still smoking. I want our actions, our marketing and messaging and our services to target these groups. That doesn't mean coercion, it means providing the right help. Last month I went out and met all of the providers offering smoking cessation services around the country. The work from these 4 regional meetings is going to feed into new smoke-free action plan. Generally, the plan will be about raising awareness of the need to quit smoking and the benefits of not smoking so that people want to quit. Quit smoking providers told us that people who have been trying to quit have tried multiple times, some more than 20. So we need to make sure that those people will give it one more go. Driving smokers to the services and providing the tools to help them succeed in quitting will be key. We know that on average, those who use quit services are 4 times more likely to be successful in stopping smoking. But the best performance services have very high rates of success. I also heard that referrals from other health professionals have dried up, which needs to be addressed. We need to leverage the range of relationships that exist in the health sector and across other agencies. I've said frequently that it doesn't matter which door you walk through as long as we get you into the system and provide you the support you need. It's also about keeping the right products accessible, as many smokers still quit by themselves. We need to be putting in place a more comprehensive and coherent regulatory regime to continue to allow access to safer and lower cost products as smoking cessation tools, and so that there is proper enforcement of the rules. This will be the next piece of legislation reform I will be taking. Continuing to measure success and using data to inform what we do and where will also be critical to measuring and delivering on success. I want to support those practical things that work. If things are working, we keep doing them. What we have been doing has been working. Given the group of smokers we need to reach, it's also important that we're prepared to try new approaches. We want to stop the harm from smoking and achieve our Smokefree 2025 target. To do this, we have to be anti-smoking, not necessarily anti-nicotine. For a long time, we've accepted that using a safer form of nicotine is an important tool in getting people on the pathway to stop smoking tobacco. This is from nicotine patches through to vaping. But if there are to be these tools or new ones, we need a better regulatory regime to control it. We've seen with the problems around youth vaping what happens if that doesn't exist. So I suppose I'd like to conclude on the topic of vaping. It's clear that vapes aren't a quit smoking device for the 10% of 14 to 15-year-olds vaping last year. We have to stop young people from taking it up as a habit. That's about controls and making vaping as unfashionable for them as smoking is now. On the control side, the bill I recently introduced that's now before the House Select Committee proposes a ban on disposable vapes, significant increases in penalties for sales to under 18s, and display and location restrictions. It's important that we have the capability to enforce the new regulations, and I've been assured that the 16 extra enforcement officers will be in place by the end of the year, and they will be dedicated exclusively to tobacco and vaping compliance. ASH's survey later this year will also provide more useful information to help us, as this year's survey is also asking more detailed questions around use so that we can clearly understand where nicotine addiction exists. I'm keen to see an increase in marketing and services aimed at youth vapers to help them stop. The social marketing and education part is important, with around 60% of vapes accessed through social supply. An obvious place to start is expanding those services in schools that already work. Finally, I know that achieving Smokefree 2025 is not our end game. We need to have a fit-for-purpose legislation and a regulatory regime that provides the same level of control across smoked tobacco and other nicotine products. We also need to remain vigilant that New Zealand remains smoke-free, that young people do not start smoking or vaping, and that those who have quit smoking or vaping do not restart. Whatever we introduce, whatever our program of work is into the future, I know Health Coalition Aotearoa will be the strong advocates they have been to date to ensure we maintain the progress and momentum to achieve our targets. This new legislation and the regulatory regime is a piece of work that is underway now. I appreciate that our pathway forward has not been consistent with the direction you wanted to take, but I can assure you our goal is common and our determination is equal. I want to thank you for inviting me here today and giving me the opportunity to talk through the pathway we are taking. And I assure you that we have a dedicated commitment within Health New Zealand, the Ministry of Health, and within my office to work to achieve our goal to eradicate the harm of smoking tobacco from New Zealand's system. Thank you.
Kia ora, thank you very much indeed, Minister. Now I'm just going to take 10 minutes to hear from Professor Chris Bullen, who's from the Health Coalition Aotearoa and University of Auckland.
Kia ora koutou, ko Chris Bullen toku ingoa, and thank you very much, Boyd, and thank you, Minister, for your talk. I guess I'm trying to answer the question, can we still be smoke-free following the repeal of the SERPA, the Smoke-Free Environments Regulated Products Act? And I think I'd agree with you, Minister, that we can, but I don't think under the current plans that you've outlined that we're likely to make the 2025 goal, and certainly not without a huge cost, and I don't believe we'll do it for all population groups. I believe that a number of issues you've touched on, perhaps I'd like just to raise, is that the responsibility of the government as a treaty partner to do right by the Treaty Waitangi. I believe there are some real questions around the way this repeal has breached obligations to Māori. Departure from the weight of evidence and expert advice that you've received, and in particular a lack of transparency until now. This is the first time I've heard a number of the things around your plans, and I'm sure that goes for others. One of the concerns around the repeal was that the plans, regardless of give or take a year or two here and there, and some of the factors that go into the modelling, acknowledging that it's an imperfect science, were that if the SERPA had gone ahead as planned, we could have been spared perhaps an additional 3,000 deaths, and particularly for Māori, where smoking contributes 2 years of the 7-year life expectancy gap between Māori and non-Māori New Zealanders. It's a really big deal from a health equity perspective and a personal perspective. So I believe that there has been damage done as a result of the repeal. It's also privileged tobacco industry advice and privileged, I believe, a sort of anti-nanny state so-called ideology over research-informed evidence and expert advice and public support, thinking about all the people who were mobilised when the repeal happened, and health professional concerns, not just one or two, but actually all the major colleges and societies responded with concern to the repeal. It's also had wider ripple effects because I believe it's damaged New Zealand's position as a leader in tobacco control internationally, and I certainly received surprised comments from colleagues all around the world, and this can have a chilling effect on where other countries, perhaps not so well resourced as us, thinking particularly of our partner countries in the Pacific, who look to New Zealand for leadership, and then seeing us apparently take a U-turn on tobacco control. So your justifications for the repeal, and I quote from Hansard, the last government was moving towards an untested regime with a focus on prohibition that ignored how well quit smoking initiatives were working. And it has been hugely successful. We have seen the numbers of smokers come down, which is great news. But you also raised a number of concerns around the impact on retailers and crime. Certainly we've seen, overall smoking rates decline. Ignore the Pacific data because this is from New Zealand Health Survey and the data were fairly unstable with a very small number of people. But if you look at Māori smoking, and this is one of my points here, is it's not just about the 6%, it's actually about the people that we are leaving behind, and thinking about Māori smoking 3 times as high still, despite the declines, which are fantastic to see. There's more work to be done in this space, and I don't believe that just individual focused approaches with providing excellent accessible quitting support are going to do the job, as well as a broader approach. And then this was one of the other justifications that I witnessed live on Q&A one Sunday morning that I was completely gobsmacked about. To be perfectly honest, I don't need a tax break so that people can die down the next 10 years from repeal of a policy. So one of the other aspects of the repeal is that I believe it really showed disregard for widespread cross-party commitment to evidence-based, comprehensive tobacco control strategies that have characterised tobacco control's history over the last 2 to 3 decades in New Zealand. Smokefree 2025 came from the Maori Affairs Select Committee, and that included the ideas of denicotinisation and retailer reduction. It was approved by National, and it aimed to reduce smoking prevalence and tobacco availability to minimal levels by 2025, so that means a retailer reduction. And this government has dismissed the legacy of the Maori Affairs Select Committee. Cross-party support the needs of Maori and Pacific people, and in securing and locking in a smoke-free future forever for our young people. And that's what the smoke-free generation policy would have brought about. Rather than what we're seeing perhaps in Australia, where smoking rates are starting to kick up again in young people, we want that not to be the future for our rangatahi in New Zealand. And so we need to safeguard that, and that's what the smoke-free generation policy, rather than being prohibition, and we accept prohibition, by the way, for lead-based paint and asbestos, but so why not for a product which is incredibly inherently defective and kills half the people who use it long term, i.e. tobacco smoking. So at the Maori Affairs Select Committee, the tobacco industry was actually held to account and called to account for its actions on killing Maori. Under this administration, the tobacco industry is being called for advice. So this is what a comprehensive tobacco control policy looks like at work, and over many, many years of wide public policies around creating an environment where smoking is not the norm has led to these historic declines, and leading the way are young people, which is absolutely, as you said, Minister, it's something to be celebrated, that smoking rates have plummeted to an all-time low. But again, it's not equal for all population groups, and we need to lock that in to secure that future, and that's where that smoke-free policy would have helped. And then you mentioned the possibility of new products coming on the market when we haven't even done the business with vaping for our young people, which has created a lot of harm and concern. So we need to, I think, really look at what these new products, what the evidence is for these new products. Can they help people to quit? Are they relatively low in harm? Well, I don't believe there is any independent, i.e. non-tobacco industry funded research which tells us that these products are fit to help people quit smoking. And so, in your own words, but you were talking about the very low nicotine cigarette denicotinisation policy. This seems to me to be an untested radical experiment to release new nicotine products on the market when we haven't even done the business with youth vaping. And so my concern, and the shared concerns of many people in this room, is that the industries involved in making oral tobacco, nicotine pouches or oral tobacco, will just be let loose to market them in various cunning and subtle ways in which they're so good to our young people. And they're already out there, in fact, even though they're not legally available in New Zealand. So my parting, I suppose, questions thinking about the future, where are we going with Smokefree 2025, is that I don't believe the government has yet achieved the right balance of regulations to restrict marketing and access to vapes. Although I have just formulated a submission which was going in, I think you're substantially on track with the new regulations, which is great to see for vaping control, but it needs more work, more monitoring, more enforcement, and good to see more enforcement officers coming on stream and greater penalties. These are all good things, but can we be assured that the same will be the case for the new nicotine products? The coalition agreement between National and New Zealand First states that the coalition will make evidence-based and pro-democracy decisions, and so far I'm not really convinced that we've seen a whole lot of evidence being used to inform the policy decisions, nor have we seen the public coming on board in a pro-democracy way. So my question really to you, Minister, is will you change your approach and honour that agreement to listen to evidence and take the people and expert advice on board? And if so, where is the evidence your approach will work, and where is your mandate? Thank you very much.
a lot of things in there, Minister, and I'll give you the opportunity to respond to some of those before we get into Q&A. So,
okay. First of all, I'd just like to sort of clarify the point, and it was made during the speech that I had turned to the tobacco industry for advice, and I appreciate there has been a lot of media noise in that space, and despite enormous efforts to OIA and WPQ me, there has been no association with the tobacco industry, and that has not been where I have gone to for advice. So just to put that to bed. How will you protect our young people from new nicotine products? And that is exactly the emphasis of this program of work that I had another meeting yesterday with Health New Zealand and the Ministry of Health around that next phase of work. And I think the key point I want to emphasise is that the legislation that was in place, we were not ready to enforce it. We were not ready to implement it, and we were going to create, as we've done through massive amounts of tweaking and amendment to the legislation, create yet more chaos with enforcement and capability. So I've been very clear that we will not introduce any other products without a very strong regulatory regime. In terms of supporting Māori health, that is exactly the point. We need to target those who are long-term addicted smokers, and across the board strategies that apply to the whole country does not provide the intervention and targeted support that is needed. We need those health providers and those quit smoking providers that are working with our Māori communities that are targeting those people will help. That does help, and it does work, and it is that narrative that we're trying to reinforce. So nothing that you have mentioned is removed, but what we have to do is ensure that when we bring in legislation, that it is more than a headline, that we have all of the systems and processes and staffing and enforcement capability and appropriate laws in place when we do something. And what we saw with youth vaping was a continuing tweaking of adjustments and child lock devices and removable batteries and just slow incremental changes, which just created confusion out there and gave a lot more noise to stuff that we didn't want young people to be doing. So we are absolutely committed to achieving this target. We disagreed on an approach, and that's all that that is as simple as it is. We are not on opposite sides, and I hope we can continue to move forward. And in terms of are you willing to change your approach and honour the agreement, I don't think I need to change the approach to honour the agreement. We are absolutely committed to the same goal, and therefore we need to make sure that what we put in place, that we have the system. And I think I just mentioned that at the time we have to remember, I live in South Auckland, so I have a pretty good idea about the illicit tobacco market and what's out there and what's available and what are the challenges that are facing our young people. I'm also Minister of Customs, and I saw the massive spike. I saw how much illicit tobacco was coming into this country. So rather than this environment that we were going to solve a problem by we were going to lock down the number of retailers, I also saw, and I could take you to the shops that provide illicit tobacco. They are out there and they're trading, and we need to stop the demand in balance with stopping the supply. And that was really the narrative that I'm hoping that we'll take away from this conversation.
And just on the evidence, about where the evidence is coming from, given the evidence from the experts in the room type of thing versus
so I suppose
what you're
I
putting up.
I can talk to, and this is where Health New Zealand is working with me, and this is why I want to talk about the data and statistics that we were talking about around the numbers and the modelling. We were given modelling numbers that were based on smoking numbers at 2019, not at the smoking numbers of 2023. So yes, I am very interested in the evidence and making sure that we get the numbers right and we're targeting the right people. In terms of introducing other products, there is no other products being introduced. What we've talked about is heated tobacco products which are currently available in the market. And so we are, and I met with Health and with Customs in the last 2 days to talk about how we evaluate whether that has been successful. In terms of tax cuts, and I know there's been a lot of noise around that, again, when we talk about evidence base, the numbers that were put forward under Treasury were based upon we didn't have anything to compare it with. So in terms of the heated tobacco numbers, we looked to Japan. Japan doesn't have vaping. So the heated tobacco uptake was distorted, and that was how we ended up with the number. So yes, I'm fully supporting going with the science and proven evidence, because as we saw when we didn't have the right evidence, we didn't get a good result, because that is not the projected number of heated tobacco. I think our total amount of sales was about 3 million in total, whereas the Treasury figures were projecting out heated tobacco uptake, and they used Japan as the example. So there is a lot of noise in this space, but I would reiterate the very first thing I did as a minister was put up the excise tax on tobacco, and I did that in January this year.
That was just the regular yearly increase, yeah. There are quite a few questions here about the evidence. I mean, this is an evidence-based group with a lot of researchers, and I'm just wondering how you're reconciling the fact that the evidence which is coming from domestic and international evidence to land on your table from experts and from the Ministry of Health has not been regarded, and that the evidence, or we haven't seen the evidence of the actions that you're actually taking. So how do you reconcile this around the agreement?
I think we've got to not conflate the two issues. So we had the repeal of the legislation that was in place, and I've said why we repealed that legislation. Moving forward into the regime that we want to set up in the regulatory regime, and my gut feeling is that we'll need to rewrite the legislation completely, because it's been tweaked and changed so many times it's hard to navigate. All of that component will be reliant on the evidence that we're talking about. So there's two issues that we're talking about here. One is what we did when we first came in terms of the repeal and the reasons we did that, and moving forward into the new regime, that is the component.
True, but none of them have had outstanding support or any real support from the experts in the room, with all those Māori groups that have been concerned. So that is an issue. And for example, the evidence around reducing the excise tax on the heated tobacco products, where was that evidence from?
Yeah, well, and again, I suppose we go back to the fact that, as I've said, heated tobacco was already on the market. There is no denying it is less harmful. Whether it turns out to be a pathway to quit smoking, we don't know yet. We do know it was less harmful. So the journey that we're taking on is to see if it is a useful tool to help people on the pathway to quit smoking. And I, this is the nature of the discussions that we're talking about, and I appreciate that you won't be agreeing with me. But what I'm here to say is that it was already available in the market. We know it was less harmful than smoking. So what we've tried to do is create a differentiation as a potential option as we work through the broader program, bearing in mind our target is to get people to quit smoking tobacco.
So thank you for that. So just on the issue of the provenance of the documents that you'd given to the Ministry of Health, and the relationships between New Zealand First and tobacco industry, I know that the Ombudsman has asked for more evidence about where they came from. There is a remarkable similarity between what the government is putting in place and what the tobacco industry has been arguing for over many years. Would you agree with that?
So what is the question?
The similarity between what the government is enacting at the moment and what the tobacco industry has been calling for many years. I mean, I think the process of where that document came from that you gave to the ministry, and the provenance of that the Ombudsman is wanting to follow up on.
Okay, so I think we're getting the issues slightly misrepresented here.
It's a credibility issue.
Yeah, so the credibility issue is around the document which has been fully disclosed. There is nothing in the document that is contrary to New Zealand First policy positions that they've had for years. I think it goes back to 2017. There's no, and I've had no involvement with the tobacco industry.
But
so
your
that's.
party has.
Hold on, we're taking questions from
Okay.
you.
So I think if we're getting to a position where we're actually challenging my credibility and my honesty, then I think that we need to call that out. I have done and said nothing dishonest in my role in this ministry. I have absolutely committed to what was in our coalition commitments, which was broadly available to everybody to see, and I've delivered on what our coalition commitments have said, and I have not had any conflict of interest in this area, and I have continued to work on the target of Smokefree 2025.
But the party, the New Zealand First Party, and the Philip Morris, two senior Philip Morris staffers who were closely involved with New Zealand First.
I don't know them.
This had nothing. You're saying this had nothing to do with the tobacco policies that have come through New Zealand First.
So we had a coalition commitment and we had a policy position. We have delivered on that coalition commitment. I'm not sure what you're wanting me to say. I have no involvement with the tobacco industry.
No, but the party has.
Yeah, but it may be worth a reminder that decisions are made by cabinet, not political parties. Yeah.
True, but it came through in the coalition agreement, which wasn't a cabinet; it was part of a coalition agreement. But that is still under investigation by the Ombudsman.
No, it's not under investigation. What it was there was a process around how information is disclosed. I received information into my office, which was in my office prior to me even getting my warrant. So this is not something that is under any dispute whatsoever. And if you read what the Ombudsman was saying, it isn't about my integrity or my honesty.
No, it's about the provenance of the document, right?
It's about the how the documents and how we track documents coming into my office in the future.
And so this does lead on to another question about the advice. The Ministry of Health advised against introducing new nicotine products, and the Ministry has put a lot of advice on your table, not a lot of which has been taken. Is that fair?
There's been a lot of advice received, yes.
From the Ministry?
From a lot of organisations, including yourselves.
Yes. And which of those organisations have you taken the advice from and the evidence from?
We're missing the point that we did a repeal process, which is underway, and we've now got another program of work which is looking into the future, and I've made it very clear why we went through the repeal process that we did and the program of work that we've got underway now.
Yeah, and the evidence for the program of work that you've got underway, which I guess is going to be announced at some stage?
Well, that we're engaging now with the Ministry and the relevant agencies.
All right. The point that Chris made about missing the targets for Maori, and that you haven't really got Maori organisations on board and behind you with this. I mean, the goal will miss it by a large margin. The Smokefree 2025 will miss it by a large margin. And so what are you doing specifically to help reduce the burden for those populations?
And that's exactly what I talked about in the program of work with the quit smoking providers, engaging with the health services to ensure we get the referrals and a range of support services that we are currently working through in the campaign.
Okay, thank you. I think you have talked about that. One last question, because I know you have to go. So what robust, and again this is coming back to the evidence, as you can see we're pretty evidence obsessed here, to demonstrate the safety and efficacy of the heated tobacco products, the oral nicotine pouches that have come into the country that we've had, certainly with the oral nicotine, that's a new product. What was the evidence that is of value to you?
So I have not introduced oral nicotine. That is not something that I have done. I understand that you can bring it in for personal use. That is not something I've even talked about or made any statement about. The heated tobacco products was something that was readily available, and that's why we looked at it as a less harm product to smoking tobacco. And that is the program of work that we've currently got underway, because it was already here. That wasn't introducing anything new. And as I've said, under the new regime, if there is any other products, it will only be part of a very strong regime around how we monitor and control it.
All right, well thank you very much, Minister. We are out of time. There's a stack of questions in there that people would have liked to have asked.
This is the point, that we will continue to engage, and that is Health New Zealand and the Ministry are working through our pathway forward to achieve our common goal.
I would like to thank you for engaging, for coming along, putting your point, and hearing the presentations. Thanks very much.
Thank you.